A delayed sleep phase disorder DSPD is an sleep disorder look at this picture shows that circadian rhythm and delayed sleep pattern. Look at this. Then polysomnography findings. Look at this graph findings. Detail going on. Introduction. Delayed sleep phase disorder is a circadian rhythm sleep disorder where an individual sleep is significantly delayed compared to the socially acceptable or desired bedtime. As a result, individuals have difficulty falling asleep and wake up at conventional times, which can affect daily functioning. It commonly affects adolescents and young adults but can persist into adulthood. Definition: delayed sleep phase disorder DSPD is defined as a chronic circadian rhythm disorder characterized by a stable but delayed sleep walk pattern, typically by more than 2 hours, causing insomnia during conventional sleep hours and excessive daytime sleepiness. Etymology: the term delayed sleep phase disorder comes from the idea that the individual's sleep phase, time of sleep onset and wake time, is delayed compared to the normal circadian rhythm. The word phase refers to specific point in the sleep wake cycle, and disorder indicates a disruption causing functional impairment. Epidemiology: delayed sleep phase disorder DSPD affects approximately 0.15% to 0.6% of general population, but its prevalence is significantly higher, up to 7 to 16% among adolescents and young adults. It more commonly diagnosed in males and often begins during puberty, sometimes persisting into adulthood if untreated. Types: DSPD is primarily classified into 1. Primary DSPD, not caused by other medical or psychological conditions. Second, secondary DSPD, associated with or exacerbated by underlying conditions like depression, ADHD, or substance abuse. 3. Mild, moderate, severe. Based on how much the sleep schedule is delayed. Mild 1 to 2 hours, severe more than 3 hours. Causes. The exact cause is not fully understood, but potential contributing factors include 1. Genetic predisposition, 2. Altered melatonin secretion, 3. Overexposure to light during late hours, 4. Lack of morning sunlight exposure, 5. Poor sleep hygiene, 6. Behavioral patterns like late night use of electronic devices. Risk factors 1. Adolescents and young adults, 2. Family history of DSPD, 3. Irregular sleep wake habits, 4. Shift work, 5. Mental health conditions, example anxiety, depression, 6. Use of stimulants or caffeine in the evening. Complications 1. Chronic sleep deprivation, 2. Academic or occupational impairment, 3. Social isolation, 4. Depression and anxiety, 5. Risk of developing other sleep disorders, 6. Poor quality of life. Pathophysiology. Pathophysiology of delayed sleep phase disorder, step by step process. 1. Disruption of circadian clock, suprachiasmatic nucleus, SCN. The SCN, located in hypothalamus, is the body's master circadian pacemaker. In DSPD, this clock becomes phase delayed, meaning it signals the body to sleep and wake later than usual. 2. Delayed melatonin secretion. The pineal gland produces melatonin, a hormone that promotes sleep. In DSPD, melatonin secretion begins later in the evening, often 2 to 6 hours later than normal, delaying the onset of sleep. 3. Increased sensitivity to evening light exposure. Individuals with DSPD often have increased sensitivity to artificial light at night. Example screens, which further suppresses melatonin and delays the circadian rhythm. 4. Reduced morning light exposure. Lack of early morning light fails to reset or advance the circadian rhythm, reinforcing the delayed sleep phase. 5. Stabilization of delayed phase. Over time, the body adapts to the delayed rhythm, maintaining a stable yet abnormally late sleep wake up, example 3 am to 11 am, which become hard to shift without intervention. 6. Sleep wake misalignment with social norms. Although sleep duration and quality may be normal, the timing is misaligned with school, work, or social schedules, leading to functional impairment, daytime sleepiness, and fatigue. 7. Psychological and physiological consequences. This misalignment can lead to chronic sleep deprivation, mood disturbances, and increased risk of depression or anxiety, further complicating the condition. Signs and symptoms. 1. Difficult falling asleep at conventional time, example before midnight. 2. Difficulty waking up in the morning. 3. Normal sleep quality and duration if always to sleep on their performed schedule. 4. Excessive daytime sleepiness. 5. Insomnia like symptoms. 6. Depression or irritability. 7. Cognitive impairment during daytime. Diagnosis. DSPD is diagnosed based on 1. Clinical history including sleep diary for 1 to 2 weeks. 2. Actigraphy test on a device to monitor sleep wake patterns. 3. Polysomnography if another sleep disorder is suspected. 4. Morningness, eveningness questionnaire. 5. Sleep logs documenting bedtime and wake time. The nursing diagnosis. 1. Disturbed sleep pattern related to delayed circadian rhythm. 2. Fatigue related to insufficient sleep. 3. Impaired social interaction related to daytime sleepiness. 4. Risk for injury related to drowsiness. 5. Ineffective coping related to lifestyle disruption. Medical management. 1. Chronotherapy, gradual delay or advancement of sleep time. 2. Bright light therapy, exposure to bright light in the morning. 3. Melatonin supplements, take a few hours before desired sleep time. 4. Sleep hygiene education. 5. Cognitive behavioral therapy for insomnia, CBT1. Nursing management. 1. Educate patient and family about sleep hygiene. 2. Assist with adherence to light therapy or medication schedule. 3. Monitor and document sleep patterns. 4. Encourage consistent sleep wake times. 5. Provide emotional support to cope with social or academic difficulties. Treatment options: 1. Melatonin 0.5 to 5 mg to help shift sleep timing. 2. Light therapy 10,000 lux light box for 30 to 60 minutes in the morning. 3. Behavioral therapy CBT1. 4. Chronotherapy adjusting bedtime gradually. 5. Medications, example hypnotics in some cases under supervision. 6. Sleep hygiene practices, avoid screens, caffeine and irregular bedtime. Psychosocial medicine. 1. Cognitive behavioral therapy CBT for change unhelpful thoughts and behaviors regarding sleep. 2. Motivational interweaving to enhance readiness for lifestyle and behavioral changes. 3. Social support groups to reduce isolation and share coping strategies. 4. Stress management training including relaxation techniques to reduce anxiety and improve sleep. 5. Educational counseling involving patient and family to improve awareness and adherence to treatment. Prevention. While DSPD may not always be preventable, the following can reduce the risk. 1. Maintain a consistent sleep-wake schedule even on weekends. 2. Avoid bright light in the evening. Seek natural sunlight in the morning. 3. Limit screen time before bed. 4. Encourage good sleep hygiene from childhood. 5. Educate adolescents on the effect of delayed sleep. In conclusion, delayed sleep phase disorder is a significant yet often misunderstood condition that can severely impact a person's academic, occupational, and social life. Early identification and comprehensive treatment involving behavioral, pharmacological, and psychosocial strategies can improve outcomes. With proper management, individuals can regain a functional and healthy sleep wake pattern. Thank you. Have a nice day.